guys, so I have a question. How would you feel if your patient didn't even remember who you were or didn't even know that they had a nurse? Didn't even know that you were their nurse. And the patient didn't have dementia, or you don't think that they had dementia, maybe just haven't been diagnosed with it yet. So I have a story for you. I went into my patient's room about 8 o'clock in the morning and introduced myself. Hi, I'm Heather, I'm gonna be your nurse today, and had the routine nurse-patient conversation with him and checked his blood sugar and told him that I'd be back to give him his meds, and then I came back and gave him his meds and, like fiddled around with his IV and all that. And so about 11 o'clock, the nurse's aide comes to me and says the patient is complaining that he hasn't seen his nurse all morning. And I was like, is this a joke? Because I know I've been in there at least 3 times. So either he's joking or he has amnesia. I thought I introduced myself and gave you your meds and poked your finger this morning, but I could have totally imagined it. So I walked into his room and I asked, so what's this? I hear about you not seeing your nurse this morning. Who do you think gave you your meds? The housekeeper? And he was like, oh, are you my nurse? Yeah, let's run through what happened this morning. I came in and I said, hi, I'm Heather, I'm gonna be your nurse today. And you said, oh good, can you check my blood sugar because my food is on the way? And I said, sure. And then I give you your meds, blah, blah, blah. You know what, judging by the conversation, the way the conversation's going, I'm gonna diagnose you with amnesia. As far as I'm concerned, I usually always introduce myself to the patient, because how awkward would it be if I just went in there with a cup full of meds and said, here, take these. I'm a stranger, but don't worry about it, you'll be fine. If I was the patient, I would be scared. But I've had patients ask me later in the afternoon, oh, are you my nurse Heather? Because my name will be written on the board. Yes, we went over this earlier. And you get an F for remembering who your nurse is. I'm usually pretty good about letting insults roll off my back like water off a duck's back. But seriously, how do you forget who your nurse is? I can give the dementia patients a pass because they don't even know they're in the hospital. But the other patients, I don't really know what's going on with them. Do any of you have any ideas? Some family members would actually like to forget that you're the nurse. It's kind of sad, and I'm not trying to scare anyone, but I'm just preparing you for what might happen so that you're not in the clean utility room crying. I've had to learn to really pay attention to family members. When I first started nursing, I gave most of my attention to the patient. And then I realized that the family members don't really like that so much because they like attention too. So if you don't give them enough attention, they'll interrogate you, they might be mean to you, and they'll bring out the claws. Sometimes they even attack you before you can even introduce yourself. Are you the nurse? Yes, hi, you know what, he has a fever and he's sweating and you need to go call the doctor and do something about it. So if we don't run out the door as fast as we can, then we're not doing anything. And at first I was thinking to myself, why are they acting this way? I don't think I was insulting them. So then I decided to pay more attention to family members by, introducing myself and talking with them, being super friendly, asking if they need anything, asking if they wanted any coffee, a foot massage, food, a car wash. Whatever it takes for you to be nice to me, I'll do it. But just because you're nice doesn't mean that all your problems are going away. Just the other day, I had a patient's wife tell me that the patient's PICC line looked funny. There was a huge bruise and it looked like it was infiltrated. So can I have someone come check it out right away? And I looked at it and I said, well, it looks okay. Sometimes they have bruising at the side. It doesn't look like it's leaking, and PICC lines don't usually infiltrate because the catheter's so long. And she's like, well, can you have someone come look at it anyways? And I was like, sure, no problem. I'm just the nurse. I don't really know what's going on. So I continued with my patient assessment, and the wife's like, you know what, our main concern is that PICC line. Can you call someone now? And I was a little bit steamed because I wanted to tell her, okay, do you want to be the nurse? Well, here's my stethoscope, here's my badge, since you know more than I do. But instead, I said, okay, I'll call the PICC nurse and have her take a look at it. So the PICC nurse came and looked at it and it was completely fine. Fine, don't believe me. Do I have something written on my forehead that says, don't believe anything I say? I'm beginning to wonder. Boy, would I like to forget those incidences ever happen. Well, I'll just let it roll off my back. Thanks everyone for watching. Have a great day and I'll talk to you later, okay? Bye.